Good afternoon, everyone. And before we begin, is everyone breathing fine? So since we're in Delhi, I'm pretty sure that's a trick question. And but keeping the humor aside, India's air quality crisis is really no joke. We're talking about a national emergency which has been disguised as weather. AQI levels that rival smoking a pack a day, and a public health burden that affects everything from child development to workforce productivity. Today's conversation is going to be about solutions that are real, scalable, and science-backed. And we do have a stellar panel today with us. So, Mahua, I'm going to start with you, where I want to understand that, all of us talk about pollution in terms of smog and winter and masks, but from a policy and energy transition standpoint, where is this crisis actually rooted? And why is AQI fundamentally an energy and infrastructure problem, not just an environmental one?
Firstly, thank you. Thank you to IVCA for doing this event on air pollution, on panel. I must also confess that when I saw venture capital and the finance industry working on air pollution, they don't normally find this topic in a finance platform. So I'm just happy that it's made its way into other chambers and not just in environmental circles. So that said, thank you very much for also having me here. Two questions that you asked me: where is this problem rooted? Let me remind everyone here that I think, like me, we all read for many years this problem was coming up at the end of the year. I'm only talking about Delhi. And it has something to do with stubble burning. Both are correct because you can smell it. But before we make that judgment, let me remind you of the science. And I did bring down a piece of paper to show this. From 1990 to 2022, dust was 10 to 30%, and this is Delhi. Transportation is 10 to 30%, so that's 20 to 60% already. Industry is 10 to 20%. You do the math. What am I left with? Agricultural residue burning less than 3% because it's only a seasonal matter. Now, where does dust come from in this city? From construction, from the roadways on the side of the road, because we haven't done something correctly enough that we've got dust patches, and transportation. In the years that I spent in the government as we were building out the electric mobility work across the country, Delhi had taken it upon itself that it was going to electrify the city. And in fact said that Delhi wants to be the electric capital, which is fantastic. So today you see some buses on the road, but really I have not seen a study that finds the source from beyond transportation. So where's the root? The root of the problem is here, this data. Let me tell you, it's not stubble burning. Stubble burning happens at the end of the year, at this time. Has it been going on? Yes. Why is it happening with so much right now? Because our climate is changing and the time between the two crops has come down to only a few days. So you're burning it off, as opposed to letting it fallow and moving it over time. That's really what's going on. You were also asking, where's the energy transition, energy lens on this? Is it environmental? I might actually go to the point of saying, well, of course, yeah, it's an everyone's problem. Energy, environment, it's a you problem and a me problem and an us problem as an institution, as a government, as a society. I don't know what it's like to raise a child. At 300, they're out. Because schools at their level of desperation, below 400, below 300, is a thumbs up day. So where is it? I'm not sure anymore. It's an energy, of course. It's an environment, of course. I think fundamentally it's a governance issue.
So, help us connect this with public health, okay? What's the most urgent transition India needs to make its cities stop choking?
I wish there were doctors in this crowd. So maybe you should take this air pollution topic to the medical schools. But there are so many cameras here, so I should also be a little... I wish we were able to get our medical schools, our doctors, our pulmonary clinics to come together and be able to show us data where over the years, consistently, is there a pattern in the amount of kids coming in with pulmonary issues, adults coming with pulmonary issues, and is there a correlation with AQI over time, over the years? I think that will answer the question.
Shubham, I'll come to you because as Mahua just mentioned that stubble burning is not the problem. I mean, stubble burning has been, it's the topic of discussion every time when political parties have to come at throats, you know, and say that, oh, it's your problem, it's Punjab's problem that this is happening. Clearly, it's not. You know, because every winter, North India becomes a gas chamber. So your model tackles this at the root by turning crop waste into boards and packaging. So how much stubble have you diverted so far, and what does it take to eliminate stubble burning at scale?
Right. First of all, is stubble burning a problem? Let me comment on that, because there are different reports. One of the report I was just reading was by the Government Institute, Indian Institute of Tropical Meteorology, IITM in Pune. And they monitor the weather and all those things. As per that report, the stubble burning contributes to 31% of the emissions which happens, the pollution happens in Delhi. But the point is not that if it is 1%, 3% or 30%. Even if it is 1%, we are talking about millions and tons of CO2 emissions, right? So we see a big opportunity, in fact, in dealing with agro waste because it is an abundant raw material which is present, right? It's not a problem, right? We have, so the products that we make out of agro waste are alternative to timber, right? We have 500 million tons of agro waste which is generated in India every year. Around roughly 16 to 20% of it is being burnt, which releases 150 million tons of CO2 into the atmosphere. Not only in Delhi, everywhere in the north. So when we create value-added products out of the agricultural waste, not only we help the farmers make money from this waste instead, but we help the environment getting alternative to timber-free products. For example, as simple as a paper bag. This is made from rice straw, right? So we don't have to cut a tree, which takes around almost 10 years to grow to make a paper bag. We can just take the abundant parali, which is left over on the farms, and create paper bags like this. We make building blocks also as an alternative to plywood, right? If you look at the hall here, imagine so much of timber is being used to construct this one particular hall, again, which has taken so many years for the trees to grow, whereas we are getting parali after or any other agro waste after every 6 months. So that is the model that we are working in CRASTE, where we don't see waste as a problem, but we see waste as a wealth to create economic opportunity to help the farmers and, of course, to help the environment.
Okay. Now, Gaurav, coming to you, OceanLux, the work that you do at OceanLux, right, it sits at the intersection of air purification, carbon removal, and urban environments, right? So what part of India's AQI problem can new age tech actually solve right now, and what's still beyond reach?
Thank you very much. So before coming to this venture, I was working as a merchant navy officer. So I found some interesting thing over there. Globally, about 76% oxygen is contributed by this water bodies. And I found a gap between existing air purifiers and such innovative solution. These air purifiers truly working on the dust removal principle. And we used to keep all air purifier in indoor space. It could be your office, your house. So I started exploring something which can generate the oxygen and can remove the CO2, a purely nature-based solution. Reason being, I switched myself to work on this Ocean Tree, which is a sustainable unit. It's work on microalgae. The technology is artificial photosynthesis. Like trees, they do photosynthesis up to 8 hours, 12 hours, and can do maximum up to 16 hours. But this unit, which is a kind of air purifier, or you can say plug and play carbon capture unit also, this is close to 6 number of trees till 60 number of trees. It works 24/7 non-stop around the year. And this is what we propose for indoor air solution, not as a AQI, but as a ambient air quality, which define how much CO2 ppm is in your area and lack of oxygen.
Okay. Now, Ravi, taking off from what Gaurav was saying, most of us, data has suggested that most of us breathe indoor air for 90% of our day, whether we're talking about offices, schools, colleges. So how much of India's health burden is actually an indoor air problem, and how does turning ACs into air purifiers play into that?
Right, so indoor air quality, right, we spend 90% of our time indoors, which basically means if I or you live till 80 years, 72 years of our life, we are going to breathe indoor air. That's the contribution of indoor air quality in your health. Of course, health depends on two factors. One is exposure time and second is concentration. I'm an aerosol scientist. I've studied the subject with hands-on experience on every technology around air purification under the sun known to humans. Now, the problem remains when we are indoors, the air quality can be much higher than what is outdoors because apart from dust and VOCs, there are other problems that can also accumulate, that is CO2, microbes, etc., etc. What we have been able to do is find the most cost-effective solution. Any air purifier you purchase from the market is just a body that has a fan and a filter. So essentially, you are purchasing fan filter at almost 10 to 50,000 rupees. Your AC always have a very big fan with a mesh filter which is worthless to remove PM particles and a cooling coil that does all the cooling or heating. You can turn your AC in fan mode and the electricity consumption will be equivalent to any air purifier. So without increasing the cost burden and electricity burden of air purifiers, you can convert your AC very simply at just 3,500 rupees for Delhi NCR, and if you are in South India, coastal India, at just 2,500 rupees. We are on a mission to break cost barrier for clean air. We can't have a price tag of 10,000 rupees per room to get clean air from these standalone purifiers, which can never get into your habit. You have a habit of using your air purifiers for almost 8 months. That's when you can also get clean air, and that is why 40% of our sales come from South India. Nobody believed people in South India will purchase anything related to air purification, but they do. There also we have a lot of pollution, so irrespective of the source of pollution, we make sure that where you are breathing healthy, that is indoors.
Vamsi, so India often debates pollution without really knowing what's happening on the ground. Mahua pointed out what have been the root causes of where the problem is actually rooted, but you can't fix what you can't measure. That's exactly the work that you're doing, where you're focusing on hyperlocal, real-time AQI data. So how does better data change public health decisions? And do cities actually react when your systems show a spike coming?
So before I go into that detail, contrary to what we see in these monitors, the AQI was almost 300 when I entered the space outside, and it is almost 130 indoors as well. So we need to measure more hyperlocally. The reason being it is varying a lot due to the built environment that we have in these cities. So currently we do monitor air quality and weather across the global south in more than 200 cities in 2,000 locations. So it goes to public through the Google Maps, so the AQI that you see in your phones is supplied by us. And how this helps public health is something the entire industry is right now dabbling with. So something Mahua has already pointed out in the start, we need doctors to come in, but that is already happening at this point of time. So there has been a lot of research which has already connected PM2.5 to respiratory and pulmonary issues. But there is ongoing research we are helping with where we are trying to figure out if unborn children are being affected by PM by monitoring pregnant women in their third trimesters. And also we are trying to see if there is a linkage to cardiac and blood issues due to PM. So this is possible when we are monitoring in the hyperlocal scale and also nearby the people that are being impacted. And just one point to add to Ravi's work, that definitely indoor has a lot of more pollutants as compared to outdoors. The major reason being the ventilation is not being properly done, and as required, the filtration is also not being done. But if we are not fixing the problem outdoors, how much ever we are doing indoors will not be helpful in the long term, but in the short term, of course, we need to do that.
Okay. Mahua, I think another thing that is very important to understand is how do we finance India's clean air transition? Especially if you could shed some light on when we're talking about carbon markets, blended finance, PPP models, how do you think will that work?
I've spent many years, in fact, I started my career on carbon markets. And when we were studying this in graduate school, the example that we all used as students was the, emissions trading for air pollution. And I think it's undoubted that that is the one environmental, financial, economic instrument that has known to work. It was first installed over California, over the city of LA, that looked like this, in fact. And it was tested out there. Unlike climate and carbon markets and those other sorts of things, air pollution markets are point source, meaning I emit it in Delhi and I feel the effects in Delhi or in a certain jurisdiction. Outside of political jurisdictions, LA did this. And it has been tested and worked in many cities around the world where emissions trading for air pollution. And I know that there's a lot of new work starting in India on research projects that first started in the city of Surat, has proved itself out in Surat, and I know that it is being replicated in small units across Maharashtra, I think maybe even Punjab. So to your point of how does one direct capital, that's the first incentive, that if industry has a target on itself, for certain levels of pollution that it's not allowed to do, and there is a market out there to trade those units, money moves in, technology moves in. All the things I'm hearing on the panel will have not just an emotionally captive market, but an economically driven market. That's been known to work. It's being used in a number of places. But I must put it out there that for cities like LA and others in the world that have used this approach, have used the market to achieve it, there has been political, administrative, I guess, control over a certain area. Other cities have not done it. They've simply worked at it through regulations, such as China. In 2008, when one of the times that I visited China was, I think, about 2008, just before the Olympic Games, when China was putting up this bird's nest for their Olympic Stadium, I couldn't cross the road outside it because I couldn't see the end of the road. I couldn't see the zebra crossing anyway. It had faded into the day, but I couldn't see the end. You can now run in China, and in Beijing, it's quiet because it's all gone electric, and the AQI is probably about 15.
All right. Now, all of you have, built very solid solutions to tackle with air pollution. So I want to understand that how can new age purification solutions can complement city-wide interventions? And Gaurav, I would like to start with you on that front.
See, in terms of air purification, they are widely scope and widely technology has been developed. Some of them are working on this AQI of dust removal, some of them are working on this PM 2.5, and ambient quality also. One of the interesting technology right now is ionizers. So ionizers have some kind of drawback, means they produce ozone. And ozone is straight away cause for your cancer. So these kind of few drawbacks coming from the air purification solutions, this we have to check. And the meanwhile, which we are doing at OceanLux. So we recently deploy our unit at Jaipur Airport, at Adani Jaipur Airport, and these are 5 units. one unit is able to produce about 1,35,000 liter of oxygen yearly, and 5 is close to 7 lakh liter. As per the ESG calculation, these 5 units are capable to feed 11,500 people who are traveling through Jaipur airport. On a daily basis, average person required 550 liter of oxygen. So this is some kind of impact which has to be visible and noted. And ESG solutions, CSR solution, and multiple angles in terms of corporates, if they are willing to spend in their money into some solution, some kind of ROI should also come from these solutions.
Ravi, if you could quickly add on the front that how this cost saving with a model like yours is compared to standalone purifiers.
Look, any innovation throughout the globe has reached to millions of households only when it became affordable. That is what we are doing. Anyways, air quality is now linked to financial well-being as well, as now schools are being shut, primary section are completely shut, they have to operate from home. Even now there are guidelines, 50% only capacity is required to be working from office, others have to work from home. So we have direct financial implications of air quality on financial well-being of any company, even our children. And these are the most affected ones. So I believe, as for example, Ford, right, what he was able to do, get cars to millions of people, same for laptop. It was able to get to millions of people like now here, only because it became affordable at large. Again, clean air shouldn't be that expensive, and we have to figure out some solution. There are hundreds of solutions out there. Which one can actually get into your house, and which one will work for you? That's the ultimate goal. You should be breathing clean and not polluted air like what we are doing even here right now. So PM 2.5 here is more than 100 for this kind of a building. So just to give you one simple example, if you were to clean air here with air purifiers, which is standalone and everybody knows about them, you have to have at least 20 air purifiers, which will cost you around 2 lakh rupees. We can do the same job in 20,000 rupees, and maybe even better. We can bring down air quality here in a single digit. That is like a guarantee. At 20,000 rupees, which 2 lakh air purifiers cannot.
Okay, that's some scale. Talking about scale, help me understand, Shubham, that what's stopping stubble burning alternatives from scaling today? And what is the viability of alternate materials versus particle board, MDF? How does that work?
So I think technology has been one of the barriers in scaling up straw-based solutions. So if I have to give example of our industry, so we are in packaging and built environment both. So rice straw contains something which is called as silica. So if the paper manufacturers have to use the rice straw-based pulp, this silica comes into the recycling stream and it kinds of deteriorates their machinery. So nobody wants to keep on investing in the capex. And that's one problem that we have been able to solve through our patented technology. It's the same case in the building sector. So if we have to make boards like this, so in the market, 50% of the particle boards which are currently present are bagasse based. Now, the conventional glue that people are currently using is called as a formaldehyde based glue to make the particle boards. So with the agro waste, the glue is not able to bond it properly, resulting it in a very inferior quality material. So that's one problem. So when it goes into the market, nobody wants to buy a product which does not have any strength. The second problem with using formaldehyde-based adhesives, and people don't talk about it usually, that it is a carcinogen. So there are governments across the world, they have limited the use of formaldehyde, they have banned the use of formaldehyde in making these MDF boards and particle boards and plywood. In India, these regulations are still not there, right? And nobody is talking about this hidden indoor air pollution, which is present in this room also. So at CRASTE, we are tackling both the outside air pollution and the indoor air pollution by creating a product which is not only sustainable, but it is also healthier for our loved ones. And that's the key differentiating factor of our boards with the conventional material which is present in the market today.
All right. Now, as we come to the end of the session, let me put a common question to all of you. Vamshi, I'll start with you. If you had to recommend one intervention, whether it's policy, tech, behavior, anything, that would show the fastest improvement in India's AQI, what would that be?
So, one in policy and on-ground interventions is something we are trying. Operation of pollution abatement solutions throughout the city, hyperlocally increasing their efficiency. For example, peak hours in different locations is different. So we operate government smog machines according to that. And coming to behavioral change, I think that is a very key point because a lot of sources are locally, let's say, open waste burning or household burning. So these kind of things are fundamentally behavioral, and we need a systematic method to change them ground up rather than top down as of now.
Mahua, what would you like to add?
I think I'd do two things. In the short term, well, I'll do three things. In the short term, look at these bubbles and put it and address each of them. For transport, if you do fleet electrification for Delhi, because I'm just talking about Delhi because it's a crisis situation here. Fleet electrification will bring that junk down, and we've done it once before. We went from diesel to CNG by law. The number of vehicles has just gone up so much that somehow that kind of got blurred. So one sort of poke over there and you'll see something. On dust, I think it's quite obvious, you know, who's creating the dust. So that has to be a little bit more than a poke, perhaps. But I think more fundamentally, it's a much larger governance issue. And it's probably incumbent on all of us as the citizens of this city to perhaps do whatever we can to request that this now needs to be addressed. We're in a situation where we're doing band-aids, right? We're even like, you know, counting the number of hours we spend indoors. That's probably because the number of hours we cannot spend outdoors. So that's not the kind of life I don't think anyone really wants to be proud of. So I think really at a fundamental level, this is it's a request as a citizen that the air is a common problem.
All right, thank you so much for such a lovely session. And I'm pretty sure if you guys want to get in touch with each of the panelists, you can reach out to them personally. Thank you so much for doing this. Thank you.